titled An In-Depth Look at Keeping Kids Safe Around Liquid Laundry Packets. Today, we are joined by three organizations that will really be taking us through what the data says, what our industry is doing, and also how nonprofit is partnering with industry. Your first presenter today will be John Colvin. He's co-director of the Drug and Poison Information Center at the Cincinnati Children's Hospital Medical Center. Your second presenter will be Nancy Bach. She's the Senior Vice President of Education at the American Cleaning Institute. And then finally, we'll have Kate Carr. She's the President and CEO of Safe Kids Worldwide. So without further ado, I will turn it over to John to start us off on a Poison Center perspective. John?
All right, thank you very much. Okay, so thank you. It's very good to be here, and as stated, I'm here to provide a bit of perspective from a poison center with regards to the issue. And just to sort of kick things off, I think I'll start with just a quick primer on poison control centers in the United States and what we do. Within the U.S., there are 55 regional poison control centers, and this group serves the entire U.S. population. And poison centers are really focused on improving outcomes and reducing the costs of poisoning. And poisoning is a bit of a slippery word. We'll go into that in a little more detail. But really, this refers to all things that you come in contact with. And so we do this in a number of ways. As many of you know, we do have a 24/7 hotline that is staffed, and we provide free advice and information on this hotline when someone has a concern about being exposed to something or being poisoned or just has a question. This hotline is staffed by medical professionals that have specialized training in toxicology. For example, nurses, pharmacists, and physicians. And another role that poison centers play that you might not have quite as much exposure to is we're very much advocates for a prevention-based approach to reducing harm. And so every accredited poison center that I'm referring to has a group that is dedicated to providing education and outreach. Poison centers train other medical professionals in the area of toxicology and in the area of poisoning. Poison centers are very involved with the information that they collect when they're handling calls. That information is used to do public health surveillance and to identify quickly potential threats that need to be addressed. And of course, poison centers also use this data to do research and to better understand how we can, improve outcomes and learn more about the things that potentially can do harm. So each year, just waiting for the slide to progress here. Okay, so each year, poison centers respond to millions of calls, and these calls are documented in a very consistent way across all 55 centers, and they're uploaded in near real time. They're de-identified, and they're uploaded in near real time to the National Poison Data System. And so the poison centers are accredited by the American Association of Poison Centers, and that's who hosts this. But of all those calls that poison centers get, about 3 out of 4 of those calls involve what we refer to as an exposure. And because I'm going to use that term so much throughout the following slides, I'll give you a quick definition for an exposure. An exposure is really refers to an individual who is exposed to something. And when there is an exposure, sometimes we're getting phone calls because that individual is sick. They're exposed to something and they're having symptoms. But other times, especially with young kids, we might get calls where there's where the child is found holding, a tube of toothpaste, and he was alone for a few minutes, and it's not really clear how much he ate or what's going on. And so that is also a potential exposure, but it doesn't necessarily mean that, that someone has been poisoned, just exposed to something. And so when we handle these calls, individuals are typically calling us because they're concerned about one of those exposures, and we handle exposures for humans and in some cases animal exposures, as you can see on the screen there. And in some cases they're calling because they have a question, and they just need an answer to the question, but there does not appear to be an actual exposure that's taken place. And so as you can see, about a little over 20% of the cases that we capture from these phone calls are involving questions. And so if you look at who's calling the Poison Center, again, about 3 out of 4 calls are coming from the general public. These are households that are calling because they're concerned about possibly an exposure to a family member or themselves. And about 1 out of 4 calls are coming from, well, mostly they're coming from hospitals, or they're coming from healthcare professionals. They might be coming from emergency, EMS units, where they're calling because they need help as well. So the Poison Center specialist that answers the call is versed in trying to understand what happened, understand what sort of risk is involved, and make decisions around that. If it's a doctor calling, the patient's already in a healthcare facility, then we're providing information in terms of the care of that patient. And if the public is calling us, we're helping them to decide whether or not they really need to seek medical care or whether they can safely, be managed at home. And so of all those exposures that we handle, and there were 2.2 million exposures that were handled by Poison Centers in 2014, about half of those involve kids that are 5 or younger. And among those, in terms of the topic we're here to talk about today, Poison Centers in 2014 handled close to 12,000 exposures to the single-use concentrated liquid laundry detergent packs, which I'll try to refer to in a shorter version moving forward here. So that's a quick primer on Poison Control Centers, just to give you some context of where I'm coming from with this information. So the actual data that I'm going to present to you is data that was collected from a group of Poison Centers. Of those 55, there's 11 Poison Centers that we are working together, and we are participating in a prospective study. And as part of this study, and again, I don't know if it's me or if the slides are just not moving for me here, but as part of this study, we are trying to better understand how kids are getting in, or how individuals are getting into the laundry packs. We're also looking at what happens and trying to better understand the trends that we're seeing. And so the data that I'm going to present is really data from this ongoing prospective study, but it does not represent all cases across all Poison Centers. It's limited to the 11 that are participating in the study. And these 11 participating regional Poison Centers represent about 24% of the entire U.S. population, so it is a representative sample. And one of the key things that we're doing with the study is we're collecting a detailed narrative where the Poison Center specialist that is handling the call is trying to understand what happened, when did it happen, what are the specific product and packaging characteristics that are involved, and just to kind of get a verbal video of sorts to allow us to do a few things. One is to make sure that the information is coded correctly, but also to then evaluate more of the situational variables. What is going on when people are getting into these products, or especially when kids are getting into these products, and what are the things that we can glean from this to move forward with strategies to prevent these exposures from happening in the first place. And so just to kind of kick things off, again, this is study data. So this is just the total number of exposures that the participating Poison Centers have been handling each quarter since the study began. And this really goes back to when these products were first introduced to the market in North America in early 2012, January, February of 2012. And so as you can see, there has been an increase in the number of calls that have been reported during the study, and that also is consistent with what is being reported across all poison control centers. In terms of the age of the patients or age of the individuals that are being exposed, as you can see, the vast majority of exposures involve kids. And in fact, to kind of break this down a little bit further, 93% of all exposures involve kids under 5, and 85% of exposures involve children under the age of 3. And as you can see, this is pretty consistent with what we see across most childhood exposures, is that 18 months is really around the peak age where we're seeing these exposures. There's really no difference in distribution of male versus female kids. So taking this apart a little bit further, when we're getting calls about these exposures, the vast majority of those are involving ingestion. So these are situations where kids are getting hold of these laundry detergent packs and they are putting them in their mouth. In many cases, there might be multiple routes of exposure, but this really reflects what is the primary route, or what is the primary reason for the route of the exposure when we're getting a call. And so the second most common route is of course an eye exposure. As you can imagine, when a child bites into a laundry detergent pack, or if it bursts, or if they have it on their hands and they then put their hands in their mouth, whatever the situation might be, a lot of times it will involve both the skin and an ingestion and an eye exposure. It really is sort of all over the board. So again, sort of high level here, medical outcome. Poison centers are handling a lot of calls related to these products. The vast majority of kids that are called into the poison center result in minor, what we would consider a minor outcome, so no more than typically vomiting, or in some cases very minor symptoms, a little bit of gagging, coughing. But in other cases, we are, in a small number of cases, we're seeing more serious outcomes, and these are situations where there could be breathing difficulty, where there has been a lot of drowsiness, and more serious outcomes that do require medical care in a hospital setting, and in some cases inpatient care. So when we look at ocular exposures, ocular exposures are similar in terms of their profile and their outcome, but the way poison centers code data, a lot of these eye exposures do result in abrasions, and an abrasion is considered a moderate outcome, and so there is a higher number of moderate outcomes with eye exposures. So just to sort of dive in a little bit in terms of what are these narratives, what is this information that's being collected at the time of the call informing us about how these laundry packs are being accessed by kids. And so one of the first things we look for is, did the child access it directly themselves? Did they climb up on the chair? Did they get into the laundry machine? Did they find it? Or is it being facilitated? And it may be facilitated because another child, a sibling, hands it to them. And in some cases, it might be a parent that is where the child, they're allowing the child to help them with the laundry. They hand them the pack, and then they turn around, and before they know it, the child's bitten into it instead of throwing it in the laundry. And of it, which you might expect when you look at the youngest exposures, so the kids that are younger than 9 months old or a year old, you're saying that there are more facilitated exposures. Trying to make my way to the next slide here. Okay, so this is another finding that is of interest. In most cases with these exposures, the product is really being accessed from a location that is within sight. so the kids can see it. There are a lot of cases where it might be up on a shelf, but it's there and they know it's there, and they manage to find a way to climb up and get to it. So the majority of these exposures involve kids that are accessing the packs from a location that is not only within sight but also within reach. So about 60% of the exposures involve situations where it's within sight and within reach, and then a smaller number where it's only in sight and then only in reach. So whether or not this is stored in a location that's within sight does seem to be an important variable. Okay, another interesting variable here when we look at these cases is that in at least 2 out of 3 exposures, the child is accessing it from the container that it was purchased in. But in about 1 out of 3, in about a third of these cases, they're actually accessing it in a location where it's been taken out of the container for some reason, or stored elsewhere from the container, and they're getting into it. And when you look at the exposures where they are accessing the pack from the container, about a third of, so out of the 2 out of 3 exposures where it's being accessed from the container, about a third of those situations, the container is actually open. It's not the latch or the canister is not closed. Okay, so move on to the next slide here. One of the other things that we've been evaluating with the study is taking into account how much of the various laundry packs are being purchased. So by looking at the amount of the product that is being sold, and at the same time comparing that to the exposure rate that we're seeing, we're able to try to understand if there are certain characteristics that are disproportionate. So in other words, for the number of packs sold, is there are there more of one certain kind of pack that are being gotten into relative to the amount of that product that's out on the marketplace? And so that helps to inform us on issues around, is the fact that some of the packs that are on the market are multicolored or have different textures. Is there in terms of how much is sold, is there a disproportionate number of exposures? There really doesn't appear to be a disproportionate number of exposures when they're normalized by sales data. And so there's no indication that a certain color or a certain texture is influencing these exposures. Pretty much they're just happening if kids are getting a hold of them. Another way to look at the data with sales data allows us, if you recall at the beginning there, we are seeing an overall, there has been a slight increase in exposures. But when you look at the amount of the product that is on the market or in households, so looking at the amount of product being purchased as a surrogate marker for how much availability there is, this chart here, it shows that the timing of some of the interventions that have been introduced by industry. So this is in particular, this is related to the exposures specifically in sales data, specifically for the market leader. But it shows that when you look at the amount of product available on the market relative to the rate of exposure, and there has been a decrease, and that decrease did correspond with some of the key packaging changes that were made. The space in the middle is the red dotted line shows the average number of exposures per 100,000 units purchased, and then the space in the middle where there is not a dotted line is really sort of reflecting the implementation period, and this was opaque packaging and the triple lock top. And then the green dotted line, it shows sort of the mean after most of the product had been introduced to the market. So there's this transition period where what's already out on the market is being sold and used, and where the newer packaging is being used. And so it's hard to really nail that down with any precision, but there does seem to be have been a decrease in the number of exposures per 100,000 units purchased that did coincide with the timing. It does not necessarily offer any sort of causality for that, but it does correspond with the timing of changes that were made. And so, in the spirit of being brief, that is the data that I wanted to share with you on this webinar. Trying to get to the next slide here. But I just want to acknowledge that the poison centers that are participating in this ongoing prospective study, that's really where all the work is happening, and the study is and has been ongoing for a number of years, 3 years, and is sponsored by Procter & Gamble, one of the manufacturers of these products.
Great. Thank you so much, Sean, for that presentation. And we'll take questions from our attendees following our last presenter. So I'm now going to turn it over to Nancy Falk with the American Cleaning Institute.
Thank you so much, and we really appreciate the opportunity to be a part of this important webinar, and I think we can actually build upon many of the concepts that John just shared. So we're going to be sharing information today about our industry's commitment to the product that we know is growing in popularity, and I'm sure all of you know that as well, and that we expect to continue to grow as consumers seem to really enjoy the convenience of these liquid laundry packets. So I'm going to be sharing information in the next few slides with you about the cleaning product industry's journey with liquid laundry packets since 2013. Sorry, my screen went blank there. So I just want to talk a little bit about who the American Cleaning Institute is, since some of our webinar participants today may not know us. I was fortunate enough to meet many of the Safe Kids folks earlier this year at PrevCon, but there's other organizations on the webinar today that may not know us. So the American Cleaning Institute is a nonprofit trade association, and we are located here in Washington, D.C. We do represent the producers, suppliers, ingredient, and package manufacturers for the cleaning product industry. And so our job is to work to sustain better living with cleaning products that do provide health and hygiene benefits each and every day for folks on the phone and the general public. We're excited that we're celebrating our 90th anniversary next year, and so we have been around for quite some time. We do have quite an extensive staff of experts here that work in the areas of research, technical, international affairs. We do work in public policy, of course, and government affairs. We work in environmental health and human safety, and of course in the area of consumer education. So consumer education has been an essential part of the Institute's work since 1926. And of course, that is designed to help consumers understand the safe and proper use and storage of cleaning products. So relationships are the backbone of the work we do. And as you can imagine, with the new cleaning products that enter the marketplace each year, our work is never done. And I think that's a good segue to our slide here about liquid laundry packets. We are seeing a constant change in the laundry aisle, with more than 1,000 new products being introduced since 1995, and of course liquid laundry packets being one of those. They have gained a great deal of attention as a product that's very simple to use and as a no-mess way to do laundry. And so over the years, our research here at the American Cleaning Institute has found that many consumers don't measure their detergent when they're doing their laundry. So we think that this new form, liquid laundry packets, does help take the guesswork out of dosing and has become a convenient choice for many, many consumers. So the product form is a good option for consumers who have difficulty in measuring liquid or laundry. I'm sorry, I think something's going on here. The slides are moving. Excuse me one second. Let me go back. Okay, there we go. So we think that we know that this is a good option for many consumers who may have difficulty in measuring more of the traditional liquid or powder detergents. And of course, this includes the elderly and some folks that are disabled. But we're hearing from both of these groups all the time that these packets have made laundry a lot easier and have made their life a whole lot better with this household chore. And so while there's a lot of consumers using this product, we still believe there's a lack of familiarity with this product, and so we still have a lot of work to do in education. Seems that many consumers don't realize that the liquid laundry packets do require the same use and storage discipline as some of the other common household cleaning products in their homes, such as bleach. And that's why we think today's webinar and the work that the Poison Control Centers are doing along with Safe Kids and many other organizations is so crucial. So I wanted to just stop for a second to set the stage for some of the comments I'm going to be sharing this afternoon, and that is to talk a little bit about our consumer research that applies to liquid laundry packets. So since 2013, we have conducted a number of surveys to better understand the consumer's world of liquid laundry packets. And so what we've done is look at their behaviors, look at their use and storage behaviors. We've looked at their perceptions of the product. And we've tried to evaluate and learn more about the safety precautions they're taking when they use the product. So on this slide, you're going to see our latest infographic that we released that communicates the results of our 2015 survey. And again, I think this marries up well with what John said earlier, and that is that 61% of the parents who took our survey admitted to storing the packets in sight and in reach of young children. So we think, again, that that's a very good indication that we need to continue to raise awareness and all the work that we're all trying to do. The cleaning product industry certainly has taken a very proactive approach over the years and is committed to any type of work that will help reduce the rate of incidents. And we are taking important steps to reduce access to packets and their contents. So back in November of 2012, when the U.S. Consumer Product Safety Commission issued a safety alert, which was meant to inform parents and caregivers that liquid laundry packets need to be kept away from children, the industry was right there by their side to drive a multi-pronged approach to reduce incidents involving liquid laundry packets. And that included working in collaboration with a lot of different groups to share preventative messaging with parents to raise awareness about the safe use and storage of packets. It also included a very strong commitment to a new consumer campaign that I'll talk about in a second, as well as a commitment to the continued facilitation of package and of product designs. So these are the areas I'm going to talk about now. I'll start off with just a quick bit of information about a campaign that in January 23rd we launched, and it is the Be the Key campaign, which is a multi-year consumer safety program, which of course is designed to raise awareness and educate parents about the safe storage of liquid laundry packets. The campaign was created in consultation with a number of organizations, and we really relied on the expertise of the Consumer Product Safety Commission, consumer groups, manufacturers, retailers, consumers, and this campaign was funded by the companies that you see on this slide. Our target was specific, and who we were trying to reach were parents and caregivers of children under 5 years old. We set out to develop a number of strategies that would reach parents in a number of ways, and as many ways as we possibly could, which included, of course, national media, social media. We have videos on YouTube, our website, and webinars just like the one today. Since we launched the campaign in front of a group of 1,000 stakeholders back in 2013, our campaign has depended on all of the partners that are helping us get safety information to the people that they reach and teach. And so their help in echoing our safety messages has been essential to reaching as many people as we possibly can. Our message was very, very simple. It was about keeping single-load liquid laundry packets out of reach of young children. And so we feel that the campaign was a milestone that really helped us reach parents in a way that we hadn't done previously. So our Be the Key campaign, you see on the slide, is still in existence today. And so I want to talk just a second about our partner toolkit. One of the key components that we put into place as soon as we launched the campaign that is still in effect today is our partner toolkit. And it's a toolkit that's available online, and we've distributed literally thousands of them since 2013 and have been making it available at conferences, educator and health-related conferences that we've been doing for the last couple of years. And so we now have this toolkit available on a USB wristband. Our toolkit contains about 57 pages, I believe, of ready-to-use information and materials, and even some of the materials we make available in Spanish. So our goal from the get-go with the toolkit is to provide these ready-to-use materials to our partners so that they can share information with all the folks that they outreach to. It is a national awareness campaign, and on this slide you're just going to see a quick sampling of some of the materials and some of the organizations we've been working with. And one of the things that I'd like to point out is that we do have a 30 and a 60-second version of our newest PSA on our ACI website. And I wish I had time to share that with you today, and I don't, but I really encourage you to visit our website to take a look at that. We also are working with a lot of bloggers, and our total program reach to date is really amazing when we count everything up to reach over 2 billion consumers. Quickly, I just want to mention that to further engage folks in our Be the Key campaign, we created an online pledge process for parents. And it does come with an incentive so that folks that take the pledge and do commit to a safe laundry behavior are entered into a sweepstakes to win a laundry room makeover. And so we have learned through trial and tribulation, I guess, and lots of research that when folks are involved in a pledge process, they are way more likely to take action and remember the topic or the behavior change that they need to make. And so we think that this online pledge is allowing us to encourage people not only to take a pledge, but also to remember what they're pledging to. And so as of today, we have about 64,000 pledges that have been taken online. And so, of course, we're encouraging everyone on the phone today to take our pledge for laundry safety. So in summary of the campaign, our campaign is still going strong today. So let me turn to the year 2014. So in addition to supporting the consumer campaign, the industry took an immediate action back in 2014 when we started noticing the exposure numbers and decided to develop a voluntary standard to help reduce the likelihood of child exposures. The standard was meant to provide guidance for the household laundry products industry, and it did focus on appropriate labeling, packaging, and design measures. So this standard was supported by leading detergent companies and was consistent with similar initiatives we've seen in other countries. We designed the standard to be very flexible and did not want it to ever preclude any of the manufacturers from adopting additional safety measures. So on this slide, you're going to see what we really focused on. So the standard was meant to reduce the visibility of packets to young children with obscure and opaque packaging, and I think you can see that on the slide in front of you. It also worked to reduce accessibility of the packets to young children with some changes in the package closure designs. And of course, it also worked to ensure that containers had appropriate label warnings and other advice, including first aid instructions on the actual product container. Just want to draw your attention for a quick second to the red icons that you'll see on this slide. Those are very, very important. They do appear on product labels today. We also know that there are many consumers that don't read product labels, but we think that these are two safety alerts that we need to raise awareness about, because they are an important alert for parents, which is why we are adding those to our product containers. So the initiation of this voluntary standard in 2014 then, of course, set the stage for what came in 2015 this year. ASTM International, for those of you not familiar, is a nonprofit organization that our industry and many of you have worked with for a number of years. For those of you not familiar, they are a forum that establishes, it's a technical, consensus-based voluntary process for a lot of different materials, products, and services. Our ACI members in the industry were involved in this process, and some of you were as well from the get-go. And it was a cooperative effort that brought together a number of stakeholders with science and research that we thought would help this process along. So it has become a standard that many have described as a more comprehensive standard than any other standard that's come before it. It's a global standard and includes organizations in other parts of the world. This new standard provides guidelines for liquid laundry packets, and of course we're focusing on packaging and labeling. And the first draft of this standard went to ballot earlier this year in March and was approved in September. And we feel like this was a major milestone for this industry and for families with children who are using this product. And so we feel like the Consumer Product Safety Commission, and I know they're on the phone today, has expressed that they are pleased with the progress that we make, and we all agree that the job is not done. So we welcome the approval of this new initiative, this new voluntary standard, of course, as we're all working together to lower that incident rate. So let me very quickly go over a couple of points that are related to this new standard. We are looking to, we're looking at the package. We're also looking at design guidelines. We certainly want to make the containers harder for young children to open while making it not so difficult that adults will get into this habit, or bad habit, I should say, of keeping the package open when not in use. Our manufacturers are enhancing the warnings and first aid instructions on packages with lots of powerful words and graphics. And of course, along with that comes the need, of course, to remind consumers to read the label. Another component will be the addition of directions to call the Poison Helpline, the Poison Control Centers, which we certainly support and we know is a very critical part of this process. And I'll stop there and say that I can't say enough about the great work that the Poison Control Centers do, both in data collection, but also in education and outreach. And so we're working side by side with them and in partnership to be sure that the information they need, they have, so that they can give that information to the callers. So what's next? We are on a journey. This journey is ongoing. We believe that our manufacturers will continue to support the ASTM standard. We know that we will be involved in some roundtable discussions with a variety of stakeholder groups in March of next year. We all know that it is essential that we continue to collect data and analyze it and use it in a way that helps us reduce these exposures. We also believe strongly that we all should continue to raise awareness and educate. And at some point, we will need to continue our conversations about unified and consistent messaging with partners so that we're all singing from the same song sheet. So conclusions, we do believe that there's been great progress that has been made. We can say that we believe prevention strategies do work, and that this multifaceted approach that's involved so many different organizations must continue. We know that each and every day we have new consumers that are purchasing this product, and we also know that we have new parents that are bringing young children into their home each and every day. So while we all work together on education and the safety standard and the manufacturers work on the actual product itself, we know that this is shared responsibility and we all need to work together. So on this slide, I've just thrown up a couple, and certainly just a sampling. It's not everything, it's not everybody, and I apologize if I missed anyone, but giving you some links to where you can find some great information out there in our contact information. So I'll stop there and turn it over to you, Kate.
Thank you, Nancy. That was a great presentation, Nancy, and thank you as well, John, and my thanks to all of you who are listening today. This is an important issue and one that we're delighted, I'm in the wrong space, to address with our colleagues who are working together. When a new product comes into the marketplace, it's important for us to remind parents if we discover that there is a potential risk area associated with that product for children. And Save Kids has worked on a number of these issues, most recently on the issue of TV and furniture tip-overs, and of course a few years ago on button batteries. Now we have looked to our learnings from those recent campaigns to help us inform and guide the work that we're doing around liquid laundry packets. As has been pointed out, parents and caregivers
have not been aware of the potential risk to young children, and they have been keeping, storing their liquid laundry packages in perhaps not the most appropriate of places. If anyone has ever been around a young child, and we've seen that 85% of the exposures, the calls to poison control centers, are for kids under the age of 3, and with a particular focus that peaks around the age of 18 months. Well, this picture is going to remind you what kids at that age do. Everything is going into their mouths. Kids are learning by touch. They're learning by putting things into their mouth. It's part of their journey. They're explorers, and this is part of the development process. So we want to make sure that parents are taking the precautions to lock up their cabinets that contain toxic products in the kitchen or in the laundry room, or to keep them up and away. And that's an important thing. We know that by keeping them up and away, that we're going to see a decrease, as we have in other areas. When children get into the laundry packages, as John pointed out, the exposures can range from no symptom at all to minor, to a moderate, or to a major outcome. Poison control centers received 32,000 calls from 2012 when this product was introduced. This data is through May of 2015. That's more than, on average, 1 call every hour. And between 2012 and 2013, there were more than 700 children under the age of 5 who were hospitalized or who experienced serious effects as a result of liquid laundry packets. And again, I'll point out the greatest impact was between kids between the ages of 1 and 2. The children who have required hospitalization have had difficulty breathing, excessive vomiting, severe eye burns and irritation, in some cases temporary vision loss or loss of consciousness. And of course, there have been a report of either 1 fatality, which is the Poison Center is reporting 1 fatality, and Consumer Product Safety Commission is reporting at least 2. So we know that the effects can be quite disastrous for families. We are very pleased to be partnering not only on this webinar, but on our overall campaign with many safety organizations, including those who are members of our Safe Kids Worldwide network, and of course our partners like the Poison Centers, as well as the American Cleaning Institute, and our campaign has been sponsored by Procter & Gamble. Our message is, our work is to get the message out, to tell families how to store the product in their home safely, so that there won't be an increase in the number of exposures or calls. And I think it's important to point out that sometimes when those exposures are calls for information, but they can also be calls for very serious side effects associated with this. In our work, that we have offered our information to all members of our network, and there are more than 400 coalitions in the United States. Our global partners have access to our information. We've also worked with our friends within the safety community. Last April, we had our Safe Kids Day event, and the information on the safety information associated with this campaign was not only highlighted at our major event in Los Angeles, but we provided those materials to 180 communities around the country that held Safe Kids Day efforts. So we're working to get the message out. We also had exhibits there from the American Cleaning Institute at our Global Child Injury Prevention Convention, or PrevCon as we called it. What exactly did Safe Kids Worldwide do? This past summer we created a national awareness campaign, It had not only national media, but social media. We created tools like infographics. We reached out to our coalitions to get them involved, and in particular focused on 10 communities. And we reached out to our partners. Our messages were quite clear. Keep liquid laundry packets out of children's reach and sight. Keep the packets in their original container and keep that container closed. And if you had a need for information or assistance, if your child got into a packet, call the Poison Help number at 1-800-222-1222. And that's a partnership that is particularly important to us, our work with the poison centers. Our strategies were quite clear. We went after national media with a radio media tour. We created a news release. We did interviews with national media outlets, and you can see some of the media that we were able to secure. This was featured on the Today Show, on CBS News, on MSNBC, on Fox, on Univision. We also had a great deal of social media and a presence on our website, and this was featured on our homepage. Visitors were able to link to our infographic, to download our tip card, to see a video on this subject, and we also spread these materials out through Facebook, Twitter, and YouTube. When we do a campaign like this, we also encourage our coalitions around the country to use their social media channels as well, so it really amplifies the message from a trusted source that parents and caregivers can turn to. We had 10 key markets that we determined were important to this population. In some cases, we were trying to reach the Hispanic and Latin population, so the focus on Univision and in some of our radio markets was quite specific to that community, and our materials were available both in English and in Spanish. This next slide might be a little bit difficult to read depending upon your screen, but it's just a snapshot of the infographic that we developed to help get this message out. And these infographics tend to be quite helpful within communities, and they get a lot of airtime and visibility. Overall, this campaign resulted in a total of 489 million media impressions, so that's a compilation of what we did with our social media, our national and local media, as well as our events that we were doing trying to reach people. An impression is a less than perfect way of measuring, are you reaching people, but we're really trying to get the message out, and it is one of the measurement tools that we have available to us. As anyone in this field knows, you hear about when bad things happen, but you don't necessarily get the message that a child was kept safe. So media impressions are a helpful guide. In terms of our outreach to our coalition network, we created educational materials, as I said. This is a snapshot of the infographic again, of our tip sheet, and as well as a snap of our video that's available on our website. And the coalitions in Alexandria, Atlanta, Detroit, District of Columbia, Houston, Los Angeles, Miami, Minneapolis, New York, and Santa Clara were where we had specific activity where we were doing boots-on-the-ground work at the grassroots level to incorporate the education around liquid laundry packs into home safety messages and community outreach efforts. These materials are, of course, while we targeted those communities, they're available to all of our partners. This slide really is just a snapshot to show some of the outcomes that we had, again, ranging from social media messaging that came from St. Louis or from Houston, or materials, the way that materials can get incorporated into a partner's newsletter. This helps get the message out, and that's what our work is all about. We also share this information with our national partners. Those are associations and other organizations such as La Raza, the United Latin American Citizens, League of Latin League of United Latin American Citizens to Head Start and the National PTA. We're working to get the message out quite broadly. Now, I wanted to come back and particularly focus on this because we know that this requires a partnership, and we heard from the Poison Center from John about the importance of what information goes out when someone makes a call on the helpline. And that's an important step, and the poison centers who are in that study are working to collect data to understand what's actually happening in a household. We know that industry is addressing this, and we're pleased to be partnering with them on this effort. And Save Kids comes in with the education and awareness campaigns, and it's not just Save Kids Worldwide, it is all of our partners, all of you who are joined on this. Campaigns like this can work, and I wanted to give the example to show that when we create a dedicated effort, we can have real and measurable results. When we launched our TV tip-over, our TV and furniture tip-over effort, and it was largely initially focused on TVs, we saw that 27% of parents said that they had heard about the risk of a TV tipping over and injuring children in 2012, the first year. A year later, that number increased to 37%. So we saw a sizable increase in the number in the awareness issue. But more important, we were tracking a number that 46% of parents who heard about TV tip-overs between 2012 and 2013 actually bought a securing device and hopefully installed it, because we wanted them to take an action to do something about it. And so we are seeing that awareness can lead to a safety action. And in fact, on this slide, you'll see that the number of children 19 and under, and again, this is largely younger children, a little bit older than liquid laundry packets, the number of them who are seen in emergency departments is on the decline. And I think that that is a result of the work of many who are focused on getting this message out, including our partners in government who lead the campaign. The Consumer Product Safety Commission has been very active on this. So I highlight this as an example that hopefully is inspirational to show that when we work together, we can actually get things done. Prevention, John said this in the beginning and I wrote it down, a prevention-based approach can reduce harm to children. And that's the mission of the Poison Control Center. It's our mission as well in this campaign. We know that we want to raise awareness. We know that we want to educate families and caregivers about this risk. And we know that we want to work with all of the partners who are involved in this important campaign to make sure that no child comes to any harm as a result of a liquid laundry packet being in their home. I thank you, and I think now I'll turn it over to Rika, who will guide us through the Q&A section.
Great. Thank you so much, Kate. And thank you, John and Nancy, as well. So I'm going to take a quick second to pull our questions down, and I'll pose those questions to our presenters. So just a second. So the first question is, why is this just laundry packets? Dishwasher packets seem to be very similar in nature. Nancy, I'm going to give that question to you.
Well, this is a question we get all of the time. We have a few hypotheses. I'm not sure that I would say that these are absolutely research-based, what I'm about to share, but there are some differences in storage of these two different products. Liquid laundry packets oftentimes are stored in a laundry room or near a laundry room, which can be an out-of-the-way location in someone's home where there isn't a great deal of activity that takes place. We know that with the dish tabs or the dish tablets, in the kitchen that are used in auto machines that for some reason parents have gotten into the habit of using locks on their cabinets in their kitchen area. And while we see that there are many parents that are locking their cabinets in their laundry room, it may not be as many as in the kitchen. So the kitchen tends to be an area where there's a lot of hubbub, there's a lot of activity, there's a lot of people around, and maybe not so much downstairs in the laundry room. So that's our perspective at this point, and I'm sure we'll have a whole lot more information to share about that in the months ahead.
Great, thank you so much, Nancy. The next question is in regards to what actually makes the pods open or actually activates the pods themselves by children. Nancy, do you want to take that one as well?
I'm sorry, you were breaking up. I didn't hear that question.
Nancy, this is Kate. I can do it. The question is what makes the pods open, but the pods are actually designed to dissolve when they come in contact with water. So if the child is putting it into their mouth and coming in contact with saliva, the saliva will begin to dissolve the packet. That's why the bitter agent that is now being put on the that will now be on the outside of the packets is meant to essentially force the child to spit it out before it begins to dissolve. If I didn't say that technically correct, Nancy, jump in.
Yeah, no, I think you said that perfectly. I think the one add would be that the film is water soluble, and it's designed for that reason, so that when it hits water in the washing machine, it begins to dissolve. So I think you got that exactly right. The bittering agent is meant to be a deterrent. So, of course, when you put that agent in your mouth, it does cause that repulsive, let's spit it out. So we're going to see more and more and more of that in the liquid laundry packets that come to market.
Great. This question is for you, Nancy. Is there any kind of R&D being done on non-toxic alternatives to traditional toxic detergents?
I think the easiest way for me to answer that question is to say that there is continuous research being done on all of the products that come to market. I think that's the one thing that the industry takes great pride in, and that is the continuous research to bring innovative products to market that solve a lot of problems, solve a lot of issues, get the job done, and are still safe when used as directed by consumers. So I think it's fair to say that the research continues. It will always continue to bring those products to market.
Great. The next question is whether eye burns in the Poison Control Center studies or just abrasions. John?
There have been there have been in situations where the eye exposure occurs and the child is managed in a medical care setting where they can diagnose an abrasion. There have been a number of abrasions. There have been more serious eye injuries as well, as was discussed throughout. So minimizing the potential for this detergent to come in contact with the eyes is key. I mean, it's clear that it's very, very irritating to the eyes. In some situations, it can it can cause more serious harm.
Great, thank you, John. There's also been a couple of questions around access to the webinar. We have recorded the webinar, and we'll make this available for our Safe Kids Coalition members on our Resource Center, as well as all attendees. In your completion of registration, you provided an email address, and we will send that presentation to you as well. So there's a question here about the ASTM standards and the package design recommendations for that standard. I'm going to go back to that slide. I wanted to view that, but Nancy, is there anything you can expand on that?
Well, you know, in a little bit of time we have left, probably not more than I've already shared. I think that there's a great deal of detail related to that standard that is available on the ASTM website, and I'm certainly happy to share additional information with folks, bring in our research folks that have been working closely on this standard. But I think there's probably, I mean, we talked a little bit about the fact that the packets will have that, the film that dissolves in water that will contain the bittering agent. And so that we think is going to be a great deterrent. And we're also looking at when a child puts this product in their hand, the need to have that packet withstand some crushing pressure of that hand so that it doesn't leak out on the child's hand or you know, burst or, you know, come out of the actual water-soluble film. So I think all of these changes, not just one, but all of them collectively within the standard, is definitely a step in the right direction in helping, you know, reduce these number of incidences. So.
Great. Thank you, Nancy. Next question here is anyone looking at the comparison of medical outcomes to laundry packet exposures versus dishwasher packet exposures? John or Nancy?
So household cleaners are the second most common kind of exposure that poison centers respond to related, especially with childhood exposures. We do get calls about the dishwasher packets, dishwasher detergents. We get calls about laundry packets as well as more traditional formulations, you know, just liquid detergents and powder detergents. We've not compared the two directly, but you know, the exposures do occur across both, you know, across both sectors. I mean, I think the point of, you know, when you're talking prevention of thinking about all cleaning agents is a reasonable approach. But you know, they are, as was discussed, I mean, they're products that are used differently, stored a little bit differently, and whether or not the strategy would be the same, you know, for dish detergents versus laundry detergents is not something that we've studied directly.
Great. Thank you so much, John. Are there any other questions from our attendees? Okay. Well, thank you so very much again for joining us today for the webinar. Thank you to John and Nancy and Kate. Kate, do you have any last words?
No, I just would like to thank everyone for making the time to join us for this important discussion, and hope everyone has a great day. And I'll take a minute to wish everyone who's still on a early happy Thanksgiving wish from all of us here at Saves Kids. Thanks for everything you do.
Thank you.